This question asks, what about a dog that can't handle walking on leash? 5 minutes in, gets anxious and pulls to go in a different direction, jumps on you and claws at you. This is a 16-month-old dog who seems to be okay off leash in the yard. As always, I can't comment on this case specifically because I would need a lot more information. But these are the questions that I would start to have and some suggestions for what I would do sort of across the board. So first up, I would want to know more holistically about how this dog experiences the world, particularly in terms of emotion and stress. Is the dog baselining in sort of a yellow zone stress level? Are we seeing anxiety broadly? Or is this very context specific? Are we seeing a dog who is otherwise normally pretty relaxed, easygoing, optimistic, curious, but in this specific context becomes incredibly aroused and anxious? And I'm going to assume that we are correct that this is an anxiety-based response. Generally speaking, by the time we're seeing behaviors like jumping on the person, trying to pull in a different direction, clawing at the person, generally those behaviors are associated with panic. And so I'll also make that assumption that this dog is up in the red zone and that the underlying emotion is anxiety. Anxiety is different than fear. Anxiety is about what might happen. Fear is about the thing that is happening. And so when we see anxiety in a dog, a lot of times it is a sort of more broadly generalized anxiety. We have a dog who is generally anxious. And of course, again, this can have a lot of nuance. Sometimes the nuance is the dog is very anxious outside. The dog is more relaxed inside. Some common comorbidities might be things like sound sensitivity, hyperattachment or isolation distress, handling concerns, resource guarding, fear-based aggression, specific anxieties around like the vet or car rides or grooming. So I would want to know more about how this dog experiences the world generally and what their other triggers might be. One thing that I would want to do sort of regardless of those answers is immediately put management around this behavior. It's super unhealthy, not only behaviorally, but also for physical health, for a dog to be experiencing that red zone level of stress on a regular basis. That level of stress is supposed to be reserved for life or death situations. And so if we're having a complete panic at things like getting out of the house, I want to put a stop to that. Because each time my dog has that experience, that negative association is getting stronger and stronger. And the stronger it gets, the more work it takes to bring back down. I would suspect in this sort of situation that the learner actually starts getting worked up well before they're panicking. In some contexts, we might see a dog go from 0 to 60, but in this type of situation, a lot of dogs would start to anticipate the walk. They would see us putting our shoes on or grabbing the leash. So I would actually want to walk this all the way back to where does the dog start getting distressed and put my management around that. And then in my behavior work, I'm going to start there. So I'm not going to start with taking the dog out. I'm going to start with it really would depend, but I might start with some desensitization to the leash and the harness. If my dog is also fearful or reactive or uncertain around dogs or people, I might start doing some of that counter conditioning work from inside the house, just looking out the window or working in the yard where the dog feels safe. And all of this might change based on the context in which I see these behaviors. And so some dogs, for example, might feel so much more restricted on leash that their anxiety is it presents in behaviors that is a lot less noticeable or aversive to us, or is potentially lower on the stress scale. And then when we put them on leash, they perceive that their ability to flight is compromised and they panic. We could also see that they're having an aversive reaction to their walking gear. There could be pain in their body. And so there are a lot of things that I would want to investigate to really kind of figure out from the dog's perspective which aspects of this are challenging. And that's going to give me a better idea of what's going on and also how to put my management into place and also how to support my dog. Dogs who are dealing with anxiety disorders, who are generally dysregulated, who baseline in that yellow zone, this is a medical condition. An anxiety disorder is a medical condition. And so these dogs often benefit from the experience of a veterinary behaviorist, a board-certified veterinary behaviorist, as well as a behavior consultant. If the dog is not generally dysregulated, but they're having what may be akin to panic attacks in this very specific circumstance, that still might be something that I want to talk with my vet about. Again, I'm going to particularly if the situation is one that is unavoidable, I'm going to be talking to the vet about a vet medication. If it's something that I may be able to avoid, like going out on leash, then I may start there. But it would really depend. I want to know what is going on for the dog. What are these different aspects? Is it outside in general that's hard? Is it being on leash? Is it having the walking gear on? Is it something in the environment that they are perceiving that I'm not perceiving? And then I would use that information to craft my behavior therapy plan. Always, of course, with management in place first so that we're not seeing continued strengthening of those negative associations. So trigger stacking isn't happening so significantly, and so that everyone can stay safe.